Dr. Denise Ejo, the CEO of Cornwall Cancer Foundation. I would like to welcome you to our Cornwall Cancer Foundation page. Our goal is to create an awareness of the challenges, support and guidance experienced in managing cancer care for sufferers, family, carers and friends. To engage with us, don't forget to subscribe to our channel. Click our notification bell.
Awareness program. Today in the house, this is brought to you in partnership with AIT, hosted by Cornwall Cancer Foundation. So let's talk about cancer this morning. This morning in the house. Dr. J, how are you?
I'm fine. Thank
you. You hear me? I'm good. Okay, now you're smiling. All right then. It was a bit, I don't know. Are you delayed? You seem to be delayed. I think you're delayed on sound. But anyway, let's go. So, how are you? Hope you're having a good rest. Don't worry, my eyes are all closed up. It's chemo that is affecting it. Don't worry about it. Just pretend you can't see it. And let's move on. Good morning. Today in the house, we've got Dr. Jumai Desiree Jamita Tuko. She is no stranger to us at all at TCF and even on the Kakaki Cancer Awareness Program. So we welcome you back, Dr. Jumai. Thank you for joining us again today. And thank you as we start again. Dr. Jumai is a consultant radiation and oncology, clinical oncologist. Let me get these words right. I always get these words all messed up. She is a fellow of the International Atomic Energy Agency and the National Postgraduate Medical College of Nigeria. Dr. Jumai is also a 2021 recipient of the Argo Scholarship Award by the Harvard Chan School of Public Health, which is under Harvard University. Her interests are in psycho-oncology, palliative care, and research. And she's currently the National Secretary of the of the Association of Radiation and Clinical Oncologists. Am I correct? Am I trying to say it as correctly as like? You know, your medical terms always give me tongue twisting every time.
Well,
don't blame me. I'm a maths teacher. We just do maths straight, just maths. Calculate, get it right, understand it. Otherwise, not good. So how are you? Sit down, relax. We want to learn from you today. And I actually like this topic. This topic is very, very dear to my heart, as you will appreciate. And you know that very well, especially from my background. So let's hit the road with the questions. I have met in the last 3 weeks a few people that are going through this, and it's very hard to advise them or talk to them about it, but just to give them a bit of strength and encouragement, at least from a layman perspective. So let's listen to you. So today we're doing the questions and the answers, or the answers to the questions, as we have titled it today. What is the meaning of metastatic cancer?
So good morning once again. So it's a pleasure being here with you again on the show. It's good to see you. You know, you always look good, chemo or not. So metastasis, actually, it's a good topic to discuss, because it's usually one of the features or one of the hallmarks of cancer that makes cancer such a fearful condition. So just down to it, metastasis itself, if we are to look at the origin of the word metastasis, the first part of the word means meta. So that's taken from the Greek language, which means beyond, to go beyond, to transcend, to spread beyond an origin. So just simply put, metastasis itself just means spread. When cancer has spread, that's called metastasis. So to put it in perspective, I'll give an example. If a cancer starts at the colon, for instance, it's called colon cancer. If for some reason the cancer spreads to the liver, it's called a metastatic colon cancer. So it's not colon cancer and liver cancer, it's metastatic colon cancer. So it's just parts of the cancer in the colon that has found its way or has spread to the liver. So another example is bone cancer spreading to the brain, for instance. So we call that metastatic bone cancer. So it's not bone cancer and brain cancer. It's not two cancers coexisting together. It's the same cancer that has found its way to another organ. So it has spread. So if I want to sort of like put things in perspective, it's just like a person having diabetes, for instance. Diabetes starts in the pancreas, an organ called pancreas. And when there's a dysfunction of that organ, the body has difficulties in producing what we call insulin. So when diabetes goes out of control, it can affect other organs that are far away from the pancreas. For instance, it can cause diabetic retinopathy, which is affecting the eye. So the eye is far away from the pancreas, but the problem started originally from the pancreas. So it doesn't mean it is no longer diabetes. It is now an eye disease. It's still the same component. It's still the same entity. So basically, in a nutshell, metastasis means spread.
So speaking for me in simple, my own terms. So you are saying that what I've always called as breast cancer metastasizing in the brain is actually called a metastatic breast cancer.
Breast cancer.
Whoa, it's the first time I've heard it that way. That's why I've always described it as breast cancer metastasizing in the brain, because that's how I've always understood it. Oh, thank you. See why knowledge is very powerful, because I would always have continued to be speaking. And most probably doctors think, what's she talking about? Yeah. But yeah, I get it now. Okay, how does metastasis occur? Did you get the question?
Like I said, from the definition, it means spread. So it's just happens when pieces, if I may use that word, when pieces of the cancer cells leave or, they are taken or break from where they start. So let's assume where they start is, my first example was the colon. So they start in the colon, and then pieces or, bits of the cancer cells in the colon leave the colon. They break away from the colon, and then they travel to other. When they find a comfortable, they find an environment in which they can thrive, they settle in that organ, or they populate. What do I mean by they begin to divide? That's what cancer is all about, being able to divide, being able to become 2 to 4, 4 to 8, 8 to 16, in a short time. So when these cells leave where they have started, when they go to where they begin to populate, they begin to divide and attempt to take over the function of that new organ. Now, how can this process happen? There are basically 3 ways by which this can be done. There is the hematogenous spread, which is also known as, you could say it has spread through the blood. There's the lymphatic system, and there's the local infiltration. Now, by the hematogenous spread, which is, it's like we know that the blood circulates all over the body. So as the blood circulates around the body, so also does the cancer cells. So it moves where the blood moves. So it can move through that pathway. Another pathway is through the lymphatic system. The lymphatic system itself is made up of vessels, is made up of tissues we call lymph nodes. The system or the function of the lymphatic system itself, it helps in moving away excess fluid. So as the system is attempting physiologically, that's normally, is attempting to remove excess fluid from the body. It is attempting to sort of maintain a balanced system for you. In the process of moving away that excess fluid, it kind of moves along with it these cancer cells. So that's a second way by which spread. A third way is through local infiltration, where the cancer cells spread to organs that are close to it. For instance, you have stomach cancer or gastric cancer, and then it's now spread to an organ close to it, for instance, the liver, because the stomach is very close to the liver. So by local infiltration, it can spread to organs close. So those are the three major ways by which cancer cells can break away or travel from where they have origin. The three pathways are the hematogenous spread through the blood, the lymphatic system, and through local infiltration. There are other ways.
Okay, so quick one.
Yes.
So what are the common sites? I'm going to try and put two questions together for you because they're quite similar. What are the common sites of the body that these metastases occur, and in as simple as possible, what symptoms are there of this cancer, of this metastasis? I'm learning the terms now.
Yes. So to start off, I think I'll start off by an opening statement by saying that cancer can spread anywhere and everywhere. But your question is the common sites, which I'll try to hone down on. So, well, I call them the LBs. That's L. They commonly spread to the lung. They can spread out to the lungs. We have two lungs. They can spread to the liver. They can spread to the lymph nodes. They can also spread to the brain. So those are the LBs: the liver, the lungs, the lymph nodes, the breast, and the bone. But it can spread anywhere, from the head down to the toe, from the skin to the muscles, to the bone marrow, to the eyes, anywhere that exists a living tissue. Cancer cells can spread to those areas and they can thrive on their own. They can populate, and like I said, they always attempt to try to take over the function of that organ. So basically, those are the common sites: liver, lung, lymph nodes, brain, and bone.
Okay, please, I'm going to cut. I know I've asked you two at the same time because you say I like to always try and bring this home, so it's as real to the public that questions are not just being asked without somebody in it. I sit in it, and the more although we do this program, I'm not a medic, and the more I listen to you doctors, the more I understand, and I'm hoping that this reaches out to all viewers who are also going through it, because understanding our bodies helps us to understand how to navigate what you are talking about. I mean, you just made a statement now which for the first time has added up or made sense. You know, when you say the liver, the lung, I can't remember. Sorry? The lymph node. Then you go to the B's, always are primary. The secondary is different, but one of these seem to be a consistent primary. So that's very interesting. I just pulled it out because I thought, no, that's interesting. That's helping to fit puzzles in for us to understand how this disease goes on its journey. So the next one was that, what are the symptoms?
Yeah. Well, so we could spend the whole day talking about the symptoms.
I know.
You know, like I said, yeah, it can spread anywhere and everywhere. So it's good to be able to understand the functions of the major organs, and then we'll be able to appreciate some of the symptoms. So by symptoms, what we mean is what a patient walks into the clinic and tells you he or she is experiencing. So for instance, if I am to talk about the spread to the lungs, Now, we have a general idea of where the lungs are situated. So they are situated, in the chest, behind the ribs. They are protected by the ribs. The lungs, we know, helps us to breathe in and helps us to breathe out. So when we have a situation where metastasis or cancer cells in the lungs are dividing, they are trying to populate, they are trying to take over the lungs, the function of the lungs will begin to deteriorate. So how does that patient complain? How does the symptom, how does it come out? There will be complaints of, look, I'm having difficulty in breathing. I just walk very short distances and I'm panting. I can't walk up a flight of stairs. I'm unable to hold my breath for a few seconds. I've been having this disturbing cough that won't go away. I've been coughing. And sometimes, the cough comes out with some blood, which we call hemoptysis. The patient too may also complain of chest pain because, we said that the lungs are situated in the chest. So you could have such symptoms from cancer that has spread to the lungs. So cancer that has spread to the liver, for instance, the liver itself is situated in the abdomen, just at the top right of the abdomen. And we know the liver helps down in breaking down a lot of waste, a lot of metabolites and all of that. It helps us with the clotting. That's when we bleed so that we don't bleed out. It helps us so we're able to control things like bleeding. So when the cancer cell has spread to the liver, is attempting to take over the liver, the function of the liver begins to get impaired. So the patient will complain of this pain. Sometimes they say there's this dragging pain at the upper part, right part of the liver, of the abdomen where the liver is situated. Sometimes they complain of, the eyes are yellow because the liver isn't able to break down certain metabolites as it should. The patient may also have complaints of, oh, I have this cut, but it's a minute, it's more than a minute, and the bleed has gone on uncontrolled. What of if it has spread to the brain? The brain keeps us alert. It helps us to remember a lot of things. There are certain neurons of the eyes that are located in the brain and all of that. So when a patient begins to tell you, doctor, I have this nagging headache, I'm taking paracetamol, I'm taking a lot of things and the headache just won't go. So sometimes, if a patient has cancer somewhere, you may, as a doctor, you'll be able to think and probably hone down that this could be metastasis to the brain, or the patient complains, I'm unable to remember things. I was just told about this thing and I can't recall what I was told. So that's spread to the brain. So, we could go on and on. Then you could also have situations where they're just basically general symptoms. You cannot hone down to any organ per se. So what are these general symptoms? General symptoms like loss of appetite. There's food, there's, being able to cook your favorite dish, but you just don't have the appetite, you just don't want to eat. So these are some of the things that you say, okay, this has probably left its confines and has gone somewhere else. The patients who could complain also of weight loss, you just generally, you just feel unwell. So those are some of the general symptoms. Then there is a subset of patients that do not have symptoms at all. Now, this group, they're actually very interesting because you may miss them. They don't have symptoms, they don't complain about anything, but the spread, the process of metastasis has started. So this is why we encourage people, cancer patients, even though they are done with their active treatment, we do encourage them as much as possible to make sure that they keep up with their follow-up visits with their oncologist, because there are certain things that we request for at this follow-up visits. We have 3 monthly visits, 6 monthly, 1 yearly, and so on and so forth, which we, of course, communicate to the patient. So as much as possible, even if you are a cancer patient and you don't feel anything, you're top-notch, you feel great, and you have an appointment to meet, you have to meet your oncologist, just make out that time, just go and have a general check, because there may be some things that have started, which you are not having symptoms, you don't feel them, but they have been able to start, and early detection would help with early treatment and so on.
Okay, so I'm going to just throw a very quick question because I have quite a few more to go. Based on what you just said now, you were just explaining the fact that the detections, or maybe I should rephrase what I'm trying to say. When the disease is coming back, is it when you may not have any symptoms? So when... Go on.
Go ahead.
No, I think you got it. Go on.
Yes. So when it's coming back, you may know and you may not know. One of the features of cancer is that it may reoccur even after active treatment. What do I mean by active treatment? You're done with your surgery, you're done with your chemo, you're done with your radiotherapy, immunotherapy, whatever you need to do, and then you've been told to take a rest more or less, and then let's just check you up. So at that point, like I gave an example, you feel well, you feel fine, so you will not have any symptoms. So those it may come up and it may not come up. So for instance, if I asked a patient to see me back in 6 months, and there's something in between the 6 months, we advise patients, please try to be vigilant. If you see anything off, anything out of the way, don't wait for 6 months. Try to come before that follow-up clinic. So back to your question, it may be visible, it may be noticeable, and it may not be noticeable.
What is the prognosis of somebody living with a metastasis? And you're not God, so I'm not putting you on the hot seat. I'm just generally, I know. So just at least give us an idea of our prayer lines, if I should put it in the best way that I can understand it. For people like me, our prayer lines.
Yes, so prognosis, basically, it's just about survival. It's a very difficult, it's a difficult question for an oncologist or a doctor to answer. And, I think you just said it, you don't know what's going to happen tomorrow, you can't really predict. But there are certain survival rates that we're able to measure, or we're able to put pen to paper to say, okay, researches have been done in the past, researches have been done by multinationals, by large institutions, by pharmaceutical companies with hundreds and thousands of patients, and they've been able to observe them. And so studies that come out of that, give us an idea of what the prognosis is, or what the survival rate of each kind of metastatic cancer would be. So from the definition, when we're talking about what metastasis is, I said that is when it leaves its origin and it goes elsewhere. So when it starts at the origin, is that they are able to take people who have stage 4 disease cancers, and then they monitor them over time, from diagnosis to a certain number of years. So an example of this survival rate is the 5-year survival rate. I'm sure you've heard that. Or you have the overall survival, or you have median survival. So I'll just talk about the 5-year survival rate.
Sorry,
a doctor says,
I don't want us to get too complex, because I want to wind up now. So, and I want to wind up.
Okay, so I will just wrap up. When I say that the metastatic diseases generally are not curable, but they are treatable and they are survivable if you are able to detect early and you are able to go for treatment early. Survival is better. So
thank you.
Yeah. Okay. So I think
you nailed it on the head, because that's exactly how I was hoping you end it. They are not treatable, but they are survivable.
They are treatable. They are treatable and survivable. But
they are
may not be
treatable
curable.
and survivable.
Yeah.
But we still will always have at the back of our mind that we live with cancer.
Yeah.
Right? All right. Thank you, Doctor. Thank you. You know, you can always go on and on when you're talking about cancer and the challenges that people face. I was actually going to throw a question about how people manage financially, but another time I'll take it on again. I want to thank everyone for watching us this morning. Thank you, Dr. Jumai, for your knowledge, for sharing with us, and for opening us up to what really this journey is all about, especially as we get into the month. We're going into breast cancer next month, and a lot of these conversations are going to be held. So really want to thank you for starting this, especially with the metastasis for us. We look forward to seeing everyone and want to thank everyone for joining us today. You can follow us all on Common Cancer Foundation, subscribe, you can share it share our YouTube, click on the information, it's all there. And you can also find us on our website, on our social media platforms, which is the Instagram and Facebook. So we are still responding. We thank you all for watching, and we look forward to seeing you in the next 2 weeks. I think we're going to be discussing about the challenges faced by cancer patients going forward, finances, everything else that has to do with our lives as cancer survivors. So thank you all for watching us this morning, and we look forward to seeing you soon. Thank you, Dr. Jumai.
Thank you so much.